Welcome to LYLAS. If you grew up in the 90s and you know what LYLAS stands for, then stick around because this podcast is definitely for you.
Absolutely. Welcome to season 2, episode 2. Gosh, we're just rolling with some hot content right now, aren't we?
Yeah, if you've stuck with us for the last 21 episodes, thank you first and foremost because we're figuring this out. When we started, we had no idea what we were doing. I mean, I'm not sure that we still
Hmm.
really know what we're doing, but I think we're getting better at it for sure. And our topics, we are so excited because our topics, I feel like, are just really exciting. They're heavy. Sometimes they're heavy. If you listened last week, then you know we talked about addiction and recovery. And this week is another heavy titled topic. But our goal was always just to bring support or resources if you are struggling with some of these topics, or just to give you some awareness too. I hope that some of our listeners,
Mm-hmm.
have experienced trauma, but maybe they know someone who has, or just to give you some more resources.
Yeah, totally. And especially whenever it comes to something like this, because it does seem like it's a hot topic just in our culture almost, or that you see on social media. And from a treatment, from an actual person kind of standpoint, I think it's really important that we just really kind of hit it as what it is and go with talking about it from all of these different perspectives to really hopefully shine some light on trauma, what it truly is, and how it can affect not only the person, but those around the individual too, as well as what they then do with their life thereafter. So I'm super excited to talk about this. It sounds odd to say, but I think we pulled stats on my patient population. I think 62% of them are diagnosed with PTSD.
Yeah, I think the research that I looked at yesterday, it's like roughly 70% of individuals will experience trauma or a traumatic event at some point in their life. And so if you just kind of like let that settle in for a minute, that 70% of us, I fall in that 70%, that we will experience this. And so certainly it's
Mm-hmm.
common, I would say.
Mm-hmm.
Unfortunately, it's common, but you also can't, there's so many traumatic things that are, there's so many events that can happen that lead to trauma that you can't plan for. I mean, if you have a parent pass away, if you or someone you're close to pass away, and that certainly that's not anything that anybody hopes for or plans for, but it happens, and so just talking about how what leads to trauma, and then also what
Mm-hmm.
can be done from an adult standpoint, but also when you think about kids, most of the kids that I used to work with in my previous school, I would say the majority of them were experiencing trauma. And researching this yesterday, it just brought back so many memories and thoughts about how I was thinking about things I could have done differently, and how we forget as educators to really think about a person's history and
Mm-hmm.
not just slap labels like ADHD or anxiety. Yes, those things can coexist, but really to get to the root of why children are behaving a certain way, or having these feelings. So we're gonna talk about it all today. We're gonna hit all the good stuff, but it's been very eye opening to me to think about too some things that I could have done differently in my practice over the last 15 years.
Sure, sure. And you bring up a good point. It's one of my favorite quotes that actually came out of the National Center for PTSD. And it's the risk of exposure to trauma has been a part of the human experience since we evolved as a species.
Mm,
Whoa.
yeah. Yeah, I mean, you think about all the things that people went through 100 years ago,
Mm,
and the Great Depression. I mean, like over each generation have had their own set of experiences and trauma responses. And you think about now kind of the things you think about, like school shootings,
mm,
or,
mhm.
unfortunately still child sexual abuse or physical abuse, and being exposed to those types of events, and how that continues in our society to permeate 70% of people are
Yeah.
experiencing experiencing something that their body is going to respond in a traumatic way. So, at first I was like, well, how much do I go into this? How much do I share?
Yeah.
And I've been pretty open. We come from a really small town. I experienced child sexual abuse as a young child from about the ages of 4 until the age of 8. And I will say, as most children, I'm pretty resilient. And I feel like I have, for the most part, been able to work through that trauma. But it's a reminder that it's there and that it is something that we have to consciously work at, whether that's
Mhm.
through treatment or just on ourselves. And so just being open to having that conversation. That's a hard thing to put out there on a public forum. I've said it in a small group. I've told friends in the past, my family knows those types of things, but to say it in a on record for
Yeah.
anyone to hear or listen, this is the first time I've ever really said that out loud. So
Mhm.
it's interesting. I really struggled with how much of that to share,
Mhm.
but it's part of my story. And part of what we're doing here is telling our story, but also embedding that in the research and how we can
Right.
move forward. Um, so yeah, that's just a little bit that I wanted to share there. I think that it's been an interesting week having had Craig on last. Well,
Mhm.
we recorded the last episode on Monday, and talking about addiction and recovery and how most people that experience problems with addiction probably experience trauma at some point in their life. And it really got me thinking about, just not that I feel like I necessarily have an addiction issue, but just thinking about how those things can manifest and turn into other issues if you don't take care of it.
Sure, sure. And that's what I hope that this episode kind of brings to is just awareness to our own vulnerabilities, and how that manifests maybe in unexpected ways. And
Mm-hmm.
so as we kind of dive into this, I think that, again, hitting on how this affects your physical health, your emotional reactivity, vulnerabilities, your cognitive processing, everything kind of gets, thrown into the mix. And the more that we can be aware of this, again, that's kind of the very first road to any level of treatment. Just like what they would say in like the AA book, you know what I mean? We got to get
Mm-hmm.
there. But yeah, so no, I'm like I said, I'm looking forward to this discussion for numerous reasons. So yes, here we go, right?
Yeah. So let's talk about, what's the definition of trauma?
Well, I think first off, and although I appreciate all social media outlets, and I think they've done an excellent job on highlighting and assisting in breaking down the stigma, just as what we do, um, I think it's important that we recognize what true trauma is, because that word and the word trigger have been utilized more frequently and perhaps in a very invalidating manner to those who have experienced trauma. So I don't want to get real thick in the weeds in terms of like, this is a diagnostic criteria according to the DSM about, um, you know, the qualifiers for the actual diagnosis of PTSD. If you're
Yeah.
concerned, schedule an appointment
Mm-hmm.
and be professionally evaluated. And that does not come from TikTok. That does not come from this podcast. That does not
That's
come
right.
from, whatever other venue we're looking at. It comes from an actual professional, and trying to find one who actually specializes in trauma or has trauma based experience would be the most helpful.
Mm-hmm.
So, you know, as that kind of quote I mentioned earlier says, in order for you to actually have the diagnosis of PTSD, which is post traumatic stress syndrome, and I mean, just as an FYI, we talk about this like this diagnosis itself has been around forever. But in terms of it actually being something that was written on paper and then able to be researched and treated, did not happen until 1980. So that to me just really is a very striking thing. Um,
Mm-hmm.
if it it's described in Deuteronomy, if you read other like ancient texts, it talks about people who are in war and just frozen like within fear. And there's a whole list of different, again, literature kind of points, facts and fictions that describe this. I mean, even in World War II, we talked about it from like a shell shock perspective, but it never had the actual name until the 1980s. So if you think about every single person who had experienced any level of what we are actually going to like identify as being trauma for centuries, that just went without help. It is just
Hmm.
astounding to me that, you know, that was the case, I guess, you know? So,
Especially, I think about like all of the men and women that came back from Vietnam
mhm,
and how they certainly had experienced trauma response to what their experiences were at war, and that there was no support really in place for those people. I think
mhm,
about my dad. You know, he had a traumatic childhood in many ways. He had, and then experience, you know, he was in Vietnam, and just wondering how differently their lives might have played out had they had support or
sure.
acknowledgement of what they had experienced. And
Mhm,
so, it's really interesting when you did pull out that statistic that
mm.
1980 is really
1980.
when it was starting to be identified, and medical professionals could then bill for treatment.
Right.
Um,
Or even research into it as an identified thing kind of happened, you know? And so with that being the case, it's still pretty fair that we're always evolving in terms of what we know, you know, and
sure.
especially as technology advances too. So, I mean, just to get to the nuts and bolts, and again, just this is the only thing that I will say from a diagnostic kind of standpoint in this. If you have experienced something that threatens your life or a loved one's life,
Hmm.
that last part is important, or a loved one's life. And these types of trauma can be from combat, you know, as we're kind of sitting here talking about from military experiences. It can come from sexual or physical abuse. It can come from learning about violence or an accident or death of a loved one. And so, here, just as a quick example of this, whenever I was a resident, I worked at a level one trauma center. And for whatever reason, at that kind of point in time, West Virginia had a slew of mining accidents that took place.
Mm.
And, you know, at that point, again, I was at the closest level one trauma center. And we all got alerted that, you know, we might have an influx of miners coming in um, to the location. And
Minors meaning coal miners,
coal
not like
miners,
a
yeah.
minor under the age of 18.
Good point. Good point. Yeah, yeah.
I had
Um,
to think about it there for a second. I was like, wait.
God, I'm so glad you said that. Yeah. So whenever that happened, what we actually ended up seeing, because there were no survivors of that accident, um, is that the people who thought that their family member was involved in it,
Mm.
they then meet criteria for PTSD because they
Mhm.
thought their family member died. Okay. So that's what we're talking about. So it doesn't necessarily have to be you that has the gun to the head. You can hear about someone that you love's life. This is all about life being threatened or nearly taken or severely injured, and then you can meet criteria for this. Again, and this can happen to children. It does talk about childhood sexual, physical traumas as being a part of it. Serious accidents, like a car accident. So
Mhm.
many people just almost think of a car accident as like a normative experience in life and don't realize the severe layers of trauma that can come with that. Um,
Absolutely.
yeah, I mean, it can totally change. I mean, incidents like that can be life changing. It comes from natural disasters.
Yeah, I was waiting for you
So,
to say that one.
yeah,
Because living on the coast, like in West Virginia, I didn't even realize there was a hurricane season until I moved to the coast at the age of 18. And all of a sudden, like everybody keeps their calendar open September through November because you can make plans, but once a hurricane has set its sights on this destination, I mean, your whole world, all of a sudden, you're packing up all your belongings. You're trying to figure out where you're
mhm,
going to go to evacuate. Are you going to stay? Are you going to go? There's this whole like limbo that you're in the days leading up to it. And so that in itself, I mean, they had Hurricane Hugo that hit here in Charleston. I
Mm.
should know when, but I wasn't here. Um, but people still talk about it. So yeah, those natural disasters. You think about Katrina and how many people were displaced from their homes and the trauma that came from that.
Yeah, and some of our listeners that are coming from the American Midwest that are constantly living with tornadoes,
Mm-hmm.
any
Earthquakes
floods.
out
Yeah,
west,
yeah,
fires.
yes. We've got a lot going on.
Yeah.
Again, the opportunity for trauma is, I mean, I kind of hate to say it this way, but it honestly is, it's everywhere, which doesn't mean that it's going to necessarily result in, a disruption. But it's important to recognize the vulnerabilities that can be out there, I suppose. Terrorist attacks, the shootings that we are now experiencing within our society, it's all about the threat of life.
Mm-hmm.
Okay. And so, I understand that there are other situations that we go through that are very upsetting and that do result in us feeling harmed in some way, shape, or form. But for the diagnosis of this in particular, this is all about life. Okay, being threatened, um, being taken, um, seeing, witnessing it happen. That's what we're talking about whenever we use the big T word for trauma. First responders, all of the
Mm-hmm.
time, that is what they're kind of being faced with. Emergency room professionals.
And they're likely experiencing like complex trauma.
Mm.
You know, they're experiencing multiple events of trauma. And so, that in itself, that repeated
Mhm.
experience of trauma is also, you've got to think about 70% of people at some point in their life are going to have some sort of traumatic experience. And like you're
Yes.
saying, there's so many ways for
Mhm.
that to happen. It's not just kind of what we typically think of.
Yeah, yeah. And so I think that that's a big point with this. And also to say just because you've experienced something that others would classify as a traumatic event does not mean that you are then going to develop PTSD. It does not mean that you are then, going to have some other type of like disruption in your life from this event. Because whenever a traumatic event happens, essentially what occurs is our system as a whole kind of takes this cognitive emotional appraisal in that moment to determine the level of threat that is happening. And if in that moment your appraisal is like, okay, you know what I mean, whatever that might be,
Yeah.
or if it is of sheer terror or danger or discomfort, then that is like the manifestation of it. So, for example, I think I was 5 years old and we were driving, I don't know, through some random bad part of like, I think it was Cleveland, Ohio for some reason. No idea why. But I was sitting in the back seat of the car on the passenger side, coloring a Hello Kitty, right?
Mm-hmm.
Coloring book. And some guy ran out of a bar and another guy ran out. And the guy that followed him out was, I'm on the passenger seat of the car. There's the sidewalk. So maybe like 5 feet away from me, shot the guy. Guy dropped dead. Obviously, dude was dead.
Do you remember this?
Yeah, yeah,
Okay. I was like, do you
yeah.
actually remember like it happening or do you just heard the story? You know what I mean? Like
Hmm.
remember it from someone else telling you the story.
No, no, we remember the story. This was before there were cell phones and everything else like that. And
Yeah.
so, my parents just drove to, like, finally got to like the nearest hotel, called 911, said that they, were also witnesses, but there were so many witnesses and things like that that were around. But it didn't even, I didn't perceive myself in danger. My parents didn't like in that moment be like, oh my God, and kind of like freak out about it. They
Yeah.
just kind of were like, probably in that moment, like, oh shit, we got to get ourselves out of Dodge. And
Yeah.
so I just remember that as being an event in my life. And there's nothing else that gets attached or associated with it because I didn't feel that I was in a threatened position.
Mm-hmm.
So that's an example, I guess, of some ways in which that can you can see something traumatic, but it not also have a traumatic effect, right?
Mm-hmm.
And there are tons of resiliency studies that are out there. And what it really comes down to is that there are so many individual differences that can be protective or adaptive, or they can
Mm-hmm.
elicit vulnerabilities and distress, and that this is often dependent upon our learning environment and the support system that we kind of grow up within. And that's a consideration to have, because in so many of these things that we're talking about, in those environments, they're not necessarily going to be supportive, loving, and nurturing places. You know what I
Right.
mean? Or you are told or feared to talk to people about them because now someone has told you that some level of harm is going to come to them. And
Mm-hmm.
so, you know, those are a part of things we need to recognize as well, is that just because something traumatic happened does not mean that something traumatic is now going to be embodied within you. But in the percent of the people that it does, it's really important to kind of recognize what some of the other symptoms of this may be and how that can truly affect your quality of life.
I think that's where schools can come in as really playing a valuable role in helping children process their trauma, or just creating that safe space, those adults in their lives. I mean, that's certainly one of those resiliency factors for a lot of children, is having trusted adults and meaningful relationships with
Mhm.
people, not just their parents, but it can be a teacher, it can be a school psychologist, it could be a guidance counselor, it could be a reading interventionist. There are so many people that work within a school community that can provide that adult support outside of just counseling. We typically think, oh, you've had this trauma response, like you need to go to counseling. But really, I actually I did a like research. We had to present some research in graduate school. And this was the topic because I was always kind of curious, like, how did I get out of it? I clearly experienced a very traumatic um, experience for a long time in my childhood. 4 years this went on and nobody knew about it. And it certainly wasn't, it could have been way worse. I'll say that much. But anytime a child is inappropriately touched against their will, like that, so many things, our brains are developing during that time. There's so many things going on that I always wondered, okay, how did I make it out? How did I not turn to, like hard drugs or
Mhm.
alcohol? Or like, how did I somehow end up here in graduate school and sort of make it, if you will? And I still don't know if I've made it because I still struggle with mental health and anxiety and ADHD. But nonetheless, I'm a successful adult. I have a career, I have a house, I have all the I have all the things that sort of society measures us as being successful.
Mhm.
And so I did some research into that, and a lot of it was about having positive adult relationships and caring environments, both within the home and also, you think, school. Most students spend
Mhm.
about 8 hours a day in a school. That's a real opportunity. And having worked in a school for 15 years that had a high poverty rate and many children dealing with all types of stress,
Yeah.
I look back and I think about, we could have done a better job of every year reviewing with staff the symptoms of trauma,
Mhm.
what we can do as adults. We tend to get so bogged down in the behavior itself, like Johnny's throwing books, Johnny's running out of the classroom, Johnny, I always say Johnny because that's what we always did, but like anybody, they're hitting, kicking, spitting. You get so focused and laser focused on the behavior and trying to fix it or help the teacher out, help the student out. You're trying to just fix the problem.
Mhm.
If we could have just taken a step back and reviewed that every year and talked about, you're going to see these behaviors because we know that kids that live in poverty have a very high risk factor to experience traumatic events. And so you're going to experience these behaviors frequently if you work in a school, a Title I school is what they're called. And so that's something that I wish, if I could go back in time, that I would
Mm.
have done year after year, is just driving that home of remembering these are the warning signs and here's what we can do about it.
Mhm.
Because I think on a broader scale, we could have had so much more impact. Did we help certain kids? Absolutely. But I think about how many kids went unnoticed
Mhm.
and how many kids that weren't acting out that didn't get our attention and didn't get support.
Yeah, and that's fair. And again, this manifests at different ways and at different times for every single human being. And I
Mm-hmm.
think that's something to be very considerate of. And that does not in any way um, have a value on the severity of the trauma that someone experienced by the symptoms that they are currently manifesting, and I would also say that there are so many protective factors on the other side of this that can come into play that keep us at distance from what happened, that sometimes
Mm-hmm.
it's not until later events occur that we notice kind of what the trauma's role actually was.
Mm-hmm.
And so, just to kind of give a few examples before we really kind of dive into from a more physical standpoint of what this can kind of look like. There was one patient that I remember distinctly having that had just graduated, I think, with her master's degree, was walking to her car, um, was sexually assaulted, never said anything because she had just scored the job, just got everything in line, went on, got married, had a wonderful, healthy relationship, worked a very successful job for 40 years, retired, and then that's whenever her symptoms started
Mm-hmm.
because her life had served as a protective factor. So the fact that she had a healthy relationship, that she was working, that she had kids, and all of these other things had um, served as, again, a protective factor with her. But whenever some of those things weren't there, when the kids had all flown off, right, and left the
Mm-hmm.
nest and were starting their own lives, whenever her job had ended, is whenever the dam broke and the flood hit. And that is a common thing that happens. And so, if any of our listeners are like, oh gosh, that is a normative response to trauma that has happened over a period of time. And it is, I mean, it just is what it is. So, there's no judgment aside from that. There's nothing you could have done differently. You did everything right. It just, now's the time in which something kind of manifests. And so, hopefully that may be validating because I know that for that person in particular, whenever we talked about it, she basically was like, "Oh, thank God, so I'm not crazy." I was like, "No, this is kind of what happens." But your
I can,
course with it has
yeah.
been different.
Well, I can relate to that so much because like I said, I feel like I've always been in a good place with it. Like it's one of those things I've been able to work through and get through it. But then, like, I shared on one of our very first episodes how in September of 2020, I started to experience panic attacks. And I sort of had always placed a lot of blame on having such a high stress job, two small kids. We had just, we're in the middle of a pandemic. There were so many factors to layer in there. I never really thought about like, this could be trauma coming out, and not that it really matters. I mean, it matters, but like ultimately I was experiencing physical symptoms that I couldn't
Mhm.
control and I needed to seek help. I think the point being, uh, and I know we've said this over and over again, is like not to wait. Like if
Mhm.
you're experiencing discomfort, to seek help immediately. Don't wait a month. Don't wait a week. I mean, if it is impacting you, to go ahead and seek treatment because it could ultimately save your life. Medication
Mhm.
saved my life at that time, and so I can so relate to just in hindsight thinking about all this. So much of it is related to each other, whatever you
Mhm.
want to call it, whether it's anxiety or trauma or stressful situation. It's all related, and it's hard
Yes.
to kind of tease apart. But to just be aware that
Mhm.
if you have experienced this, that it could at some point come out, and not to shy away from seeking help for it.
Yes, yes. And I mean, that has always got to be the key, I think, takeaway within this. And so, if here's some common disruptions to a person's like physical health that are generally linked to trauma. So if you have had some type of traumatic experience within your life and you're having these types of things, this might be an indicator that um, a different level of assistance might be needed. And maybe that's just listening to the podcast. Maybe that's just using some of the resources. I'm not saying everybody's got to go to treatment. That's not 100% necessary. But if you do find these things to be disruptive, again, to your quality of life and to your relationships, then that's whenever help's needed. One of the most common things that we see with trauma folks is sleep disturbances.
Mm-hmm.
Okay.
Mm-hmm.
So, not only does it manifest in the form of nightmares, which I think we all can kind of know just from common culture, uh, knowledge, whatever, is that sleep at its definition, at its form, is a behavior. All right. I mean, think about it this way: we train babies to sleep in the night and to be awake during the day, right?
Mm-hmm.
So, sleep above all things is a behavior. And whenever you are having an experience in which sleep is then learned to be unsafe, then you are going to have difficulty sleeping.
Mm-hmm.
Okay. So, again, examples of this might be that maybe you had a house fire as a child and it happened at night. Okay. Or as an adult, it does not matter. That in
Right.
and itself, because we have to feel safe a lot of times to be able to fall asleep. But
Yeah.
whenever, again, we learn that sleep is not safe because of a traumatic event, then we're going to have difficulties with sleep. Um, and so house fires, again, in the cases of sexual abuse, oftentimes that's whenever the knock on the door, the cringe would happen, you know what I mean? And so that's whenever people would fake asleep, not fall asleep, do whatever they had to do in order to avoid that occurring. It can be from military personnel who were in places where bombings were happening or they had to be on alert. um, it can be from even hearing an alarm. So some of the first responders, they might be sleeping in their EMS stations or their fire stations, and then they hear the alarm go off. They know at that point that someone's life has been threatened. Okay. All of these different factors can affect a person's sleep. And it may not, again, manifest right away. It can come back at other points of time in life. And so if you notice that your sleep is disrupted and disturbed, then that might be something to kind of look at, and to talk to your PCP about, to talk to, again, a professional who's been trained in trauma and that can work with you on that, because basic sleep hygiene skills that you might learn from one level of professional is not the same thing as treatment for trauma related to sleep disturbances. And so, again, we want to make sure we're doing the right thing by folks here. Um, and that's just it's very common. And I would also say that from a treatment standpoint, if you are going through trauma treatment, whether it's a CBT, a cognitive processing kind of thing, an exposure based type of therapeutic approach, it is also incredibly common for the patient then to not sleep the night before. Like, I can't tell you how many times that would happen where whatever level of a person I was talking to would be like, I never sleep the nights before I come in here and talk to you. And I said, yeah, that's because you're human. That's correct. You're not going to sleep because you know what's coming to you the next day.
Yeah.
Um, and so again, that can be very validating. And then that can also be a point again where we learn to heal from it. And
Yeah.
there's, again, treatments and in working with a professional can really help to address that. But if you do happen to notice that sleep is a part of that equation for you, then that might be a sign to try to get some help at that point.
And that's the same for children. If you're noticing like sudden bedwetting or difficulty sleeping, falling asleep, same thing. That's definitely a warning sign. Some of the other just warning signs looking at if there's like a sudden decline in a school performance or they're having difficulty with maintaining friendships in school, that can certainly be a warning sign. regression in behavior, like I said, bedwetting, or if they start sucking their thumb again, that would be um, a warning sign. And then increased arousal. So, like quick to anger.
Mm-hmm.
You think about, I worked with a lot of kids, and the referral concern would be he's just so angry, or he goes from zero to hero. And so that's certainly an indicator of trauma. And then as for adults, teens, hopefully not young children, but maladaptive coping skills,
Mm-hmm.
drugs, alcohol, those types of things, severe aggression,
Cutting.
definitely cutting. That's another big one that we experienced a lot in middle school. Can certainly be an indicator of trauma. So just keeping those things in mind. And then what do we do? Okay, let's say you've got a kid and you're thinking to yourself, you're listening to this, and you think to yourself, I've noticed some of these behaviors in my own child. What do you do? What's the first thing you do? And of course, as an educator, I'm going to tell you to reach out to your school psychologist, reach out to your guidance counselor. Schools have, as we talked about in one of our previous episodes, multi-tiered systems of support. So there
Mm-hmm.
are layers of support that we can give to children, not necessarily that doesn't mean identifying them and putting them in special education programs, but they could go to small group counseling with the guidance counselor, and that might be enough. Just like we're saying, there's a continuum of services out there. You just have to know where to look for them and kind of be willing to put in the time to work the continuum. I
Mm-hmm.
always would say special education should be the last resort. It should be the last thing that we look at, and we should see how we can support this child another way through
Mm-hmm.
the other avenues that we have within a school building. So if you've got a kid and you're sitting there thinking, I am concerned, I've noticed many of the things you all have already talked about, reach out to your school and just say, hey, how can we have a meeting? Things are confidential. We're the same as private providers. We have to abide by confidentiality. And so the the sordid details that may be difficult to share, those aren't going to be passed around the school. Those are going to be kept within the mental health community within that school that's going to be working directly with that child.
Mm-hmm. Yeah, and it's great that the school systems are so equipped to be assistive in that. And if it's summertime,
Mm, yeah,
you
that's
know,
another good question.
right? Or if you are an adult, then again, this comes down to maybe reaching out to some of the different behavioral health, mental health facilities and places that are there and that are with you. Um, to see what services might be available, but it's also coming down to doing a safety assessment with that individual, especially if you are a parent of a child, where you suspect that maybe something happened or something may be happening. Sometimes delaying that is not the answer. And so there are, again, different resources out there, and we'll post them, um, that you can have developmentally appropriate discussions with children at any age to assure their safety and
Mm-hmm.
response. And so I think it's important for us to do that with them at those kind of points in time. Um, and then to kind of reach out for different levels of help based upon what we are able to find. And in doing so, it is taking a very non-judgmental, a very safe, safety promoting stance towards this in every way, shape, and form. Again, so that way we are not serving as a way to further the trauma that a person has been exposed to in that kind of realm. So it is, I mean, those are great things to mention.
Right. I think it's important to remember that most kids, most adult, most of us are pretty resilient. Uh, will recover, if you will, or however you want to say it. We'll
Mm-hmm.
be able to work through it. About 30% of people who experience trauma will go on to struggle with like addiction, mental health disorders. So you're not tied to it. For the most of us,
Mm-hmm.
thankfully, we have a lot of these protective factors in place, and you'll be okay.
Mm-hmm.
You get some small group counseling at school and work through it, and you'll be fine. And then others may not. And
Sure.
so it's okay to be the other too. It's
Mm-hmm.
okay
Mm-hmm.
to to be that 30% that really is going to have to work at it for the rest of their life. But just
Mm-hmm.
also recognizing that most people will recover from traumatic experiences,
Yeah.
given the protective factors that they have in place.
Sure.
Uh,
Mm-hmm.
but that it's okay to reach out for help if it's not resolved, or if it comes up later when you're 38 years old and in the middle of a pandemic, you have to reach out. And as embarrassing as it is, even knowing what I know about mental health, it took me 30 days before I reached out for help of just experiencing it. And I'm like, think of the trauma that I probably caused my children as they watched their mother in the fetal position, sobbing, not able to control myself. So yeah, just learn from me. And if you find that it is impacting your life to such a degree, reach
Mm-hmm.
out for help. And that might just be your primary care physician. They might be
Mm-hmm.
able to get you the referral to the next place to go. Unfortunately, it's like everything. It's a continuum, and you got to be willing to put in the work.
Definitely.
Say.
Yeah, definitely. And even with, a few other kind of points on that too, is that sometimes I don't know that we're, again, aware of how our body has internalized trauma
Mm-hmm.
in and of itself too. And so I think I mentioned this on a previous podcast, but I've worked with a very gifted GI doctor who um, who I see probably about 90% of his patients, because he diagnoses them, and this is not a true clinical diagnosis, so to speak, but of PTSD of the stomach.
Mm.
And so if you have gut issues, and again, may have had some level of a traumatic, or if you even just have, you know, really strong emotions or pretty reactive anxiety at different points in time, it's important to understand that your GI system also responds to that. And that
Mm-hmm.
is because of um, the whole physiology of which our body is made upon. It is designed by design to respond to stress.
Mm-hmm.
Okay. So it goes back to that whole parasympathetic, sympathetic, the fight or flight system that our body has.
Yes.
And that was designed by God, by evolution, by whatever your creator belief system is, um, to help us to survive whenever we were threatened. Like that's what its
Mm-hmm.
job is. It's supposed to shut down all of the unnecessary systems so that way we are able to respond to the saber-toothed tiger chasing us down the road. You know what I mean? Or whatever that happened to
Yeah.
be at that point in time. Unfortunately, again, since we've also evolved as humans, the potential for trauma is still there. And whenever that happens on a continual basis, again, in the cases of abuse of first responders, medical professionals, military, the list can kind of go on. Um, People living in terrorist ridden countries or situations, your body is continually exposed to something that it was not designed or equipped to deal with. And
Mm-hmm.
so, even in the absence of the threat, whenever you experience an adjoining emotion or situation, it can cause that physiological reaction, which can be, an upset stomach. We call it like butterflies in your stomach for a reason, or that you can have an IBS reaction. IBS can either be constipation or it can be, the explosive diarrhea stuff that comes in with it, all of which can be incredibly disruptive to your life.
Mm-hmm.
And it really does come down, honestly, just to understanding that physiological process and how it is connected to a psychological event. And once that connection is made, then you can start to have control over your body because now you are aligning the two together. And whenever we have like
Yeah.
body and mental, emotional wellness, then everything can kind of be in tuned and heal. But when one is, again, kind of on the fritz or dysfunctional, then the both are going to be, or there's going to be a disconnect or an imbalance that then just continues to impede upon our quality of life. And so, GI things are a very common occurrence whenever it comes to trauma responses, especially in adults, but can also occur in kids too. So, from again, a health standpoint, sleep, GI, um, chronic pain can even be affected. from trauma responses.
Mm.
And then your social life. I mean,
Absolutely.
huge impacts can come from that, and that's not something to shy away from. It's something, again, at that kind of point, to seek and get some assistance and help in, so that way you can re-engage in life the way that you want to, and the trauma does not have to be holding you back from whatever it is that you want to experience in life.
I think that's such an interesting point that you bring up, in that, it can cause these IBS symptoms, all of these things. And so if you're experiencing these symptoms and you go to a GI specialist and you say, I'm experiencing this, they may, I've never been to one on it. I'm sure they prescribe you something, anything. But just having that conversation with that doctor to say, you should also know that I experienced trauma at some point in my life. And so that it's a whole picture and not just treating the symptom, if that makes
Mm-hmm.
sense. Because medical professionals, at least in my experience, the ones that I've gone to, they tend to treat the symptom, which is appropriate. I mean, when I'm having panic attacks, I was very thankful that they had medication to make them stop, and it's certainly appropriate. But you also hopefully have a physician that you feel comfortable enough sharing all of the things that could
Mm-hmm.
be impacting your physical symptoms. So just being on, you may not think, oh, I'm going to this GI specialist. He doesn't need to know about my trauma, but you're saying he does, because
Yeah,
it could
and
impact your treatment plan.
again, I'm very fortunate that I work and have developed integrated care systems where, because that's what I like to practice in, so that's what I develop and work in.
Yeah.
That this physician doesn't necessarily even rely on the patient to make the disclosure. He actually listens to their symptoms and then asks their trauma history.
Mm.
And I think that that's important, because that's a true level of holistic care that can take place. And I think that I don't think that that's unique to integrated settings, but I think it heightens their awareness to how the psycho-emotional um, system can affect a person's physical health. And so whenever he has a patient that presents to him with those symptoms, he does do like a trauma inventory. And then, as
Mm.
part of the treatment plan, is to get referred for psychological assistance. So every single one of them, all of them. If you have been diagnosed with PTSD, or you believe that you are, or that someone that you love is, and they have been prescribed a benzodiazepine that is ineffective and non-advised treatment,
Mm.
you can Google it all you want, and they're never going to tell you to put somebody on Xanax that has PTSD.
Interesting.
Yeah, it is. But because the symptoms, again, may sound like something that you might prescribe that medication for, it is actually counterindicated for PTSD.
Mm.
It can make it the National Institute on PTSD, that's one of their number one disclaimers, is that benzodiazepines are not advised as treatment for this. That the frontline treatment, as we talk about, might be some antidepressants, some SNRIs, SSRIs,
Mm-hmm.
but the main treatment for PTSD is going to a trained psychotherapy provider who can assist with what's going on. And from that perspective, again, I'm not working with the itty bitties. Okay.
Yeah.
So it's really important that the provider that you go to is trained to work with the specific population that you are dealing with
That
or
you're following for.
encountering on them. Mm-hmm.
Yeah. That's interesting, Austin. I feel like I say that a lot, but I was confused when I was put on an antidepressant, because I'm like, I don't have depression,
Mm-hmm.
you know. But that's interesting that that was the appropriate medication for what I was experiencing, and it did, at least for me personally. And again, we all have our own health journey, but it did relieve me from experiencing panic attacks. Once I was on it for a steady amount of time, we had to switch it a couple different, I tried a few different ones.
Mhm.
Didn't like some of the side effects, if I'm being real honest. But yeah, I had never known that. I mean, we take a course in graduate school. At least I did. I took a course um, in medication, going over medications, but like I had never really thought about that as being non-affected or non-effective for someone who's experienced trauma
Yeah,
or
it
has
is.
PTSD.
It will make it worse. I mean, it just to kind of call a horse or whatever. It is not like that is not a good thing. It is not a good thing. And it's common. I'm not saying that it's because a professional is not well knowledge. I mean, their job is just to kind of, especially in some of these cases, they'll just, write whatever at that point. But that's where it really makes good sense to get to someone who is trained that understands what the proper medications would be for this kind of scenario and case with it. But in general, benzodiazepines might be helpful for other things, but for PTSD, it is not. And
Mm-hmm.
I mean, anyone can read that and read that sentence aloud and just know that that's a fact.
Mm-hmm.
So,
Very interesting. Um,
yeah.
what else? Like, what else
Um,
have we gone over? We did go over most of it. I also, just to touch again on like the behaviors that children experience in school, inattention, probably the number one thing that comes up when we sit on MTSS teams. This kid can't pay attention. He can't do his work. Inattention in itself is another risk or another warning kind of sign. So we're, and again, not saying that you can't have ADHD and have trauma history. You can,
mhm,
um, and that medication isn't appropriate for that. I'm not giving that sort of advice. I'm just saying to really think about what's going on here, not to so quickly put a label on a child specifically
mhm,
when you haven't really explored all the options.
mhm. Yeah.
Because ADHD, in my opinion, is over diagnosed in particularly young males and typically African American males.
Mm-hmm.
Um, and so, I can't tell you how many kids, oh, this kid, and people so willing to walk around and just throw labels out. This kid has ADHD. This kid's bipolar. This kid, with no basis, no understanding. And I mean, you and I both, we have a feeling about how just people so quickly throw these terms around when they are major meta or mental disorders,
Mm-hmm.
and that people feel so comfortable labeling people that way.
Yeah, it's a very unfortunate situation for sure. And again, I think that it serves in many ways as a barrier to care.
Yeah.
And
Or it just continues the stigma that something's wrong with you, that you're
right,
defective in some way, or that, you're crazy. you
right,
know?
right. You mentioned kids in this, and I think that this is also a point to kind of mention is that whenever we are talking about trauma, and this is particularly seen a lot of times in military or first responder based families, is that there's primary and there's secondary victims of trauma.
Mm-hmm.
And the primary victim is the person that it happened to, that the event occurred with.
Mm-hmm.
And the secondary ones are the family members who are
Mm-hmm.
then connected to the person who has experienced the trauma. And that, what I'm saying whenever I mention that, it's not that they are having an effect because they heard about what's happened, it's because the person that this stuff happened to has now changed and their relationships have changed and they
Mm-hmm.
don't have um, the framework to necessarily understand kind of what's going on. And so this is where, the VA system is really great at working with veterans as well as their family members to understand what trauma is like. I've worked with, I do a lot of fire work and police work. And so a lot of different associations related to those professions will also have family support so that way they understand kind of what's going on with their officer or their fireman. Um, but we really want to kind of be considerate of that as well. So even in kind of linking back to some things that Craig had mentioned in his talk, when someone has experienced trauma as an adult, it is hard for them to then be immersed in regular life-based
Mhm.
activities. And,
True.
it wasn't until, I mean, even 20 years ago, whenever we were, in the early 2000s when Operation Iraqi Freedom and Enduring Freedom and the invasion of Afghanistan and all those things took place, we really weren't debriefing or helping or having some type of post care for veterans coming home. And it was from years of research in those guys after they came home that, we thought that they had what we would call PTSD, but it was actually in a different form. And that's because they had blast based injuries or they had TBIs on top of being exposed to trauma, which creates a different picture, which actually created a different level of criteria for us in order to be able to diagnose PTSD within that population because our treatments weren't working. And when we found that our treatments weren't working, it was because the beast changed. And so trauma can kind of be thought of maybe as a dog. And I'm not saying this, I'm saying this to make it relatable. There are many different species of dogs.
Mhm.
My Bernie Doodle is not the same thing as a Chihuahua, but they are both dogs. And so
Mhm.
we really need to understand that, trauma takes many different shapes, forms, species, looks different, and it affects people from different levels of abilities. And, what our picture of something is may not be what it actually is. We have to be willing to see it from that individual's kind of standpoint and what's going on with them. And from a family standpoint, it is really important that the family then has some kind of base and understanding for how this does change interactions, how this does impact things growing up. You and I both share that my stepdad and your dad were Vietnam vets,
Mhm.
and I I just walk around, I think, in the world oblivious to most things. That's why shit doesn't affect me, is I'm just like, oh, there's a bird. Um, but jeez. But as a
Funny.
kid, I never really paid attention to the fact that we let off firecrackers
Oh,
like
yeah.
at my house at like dusk. It was never dark. It was never dark. And I was like, well, this is I mean, I would see like people would do that at other places, but then it was because my stepdad, had been in
Mhm.
Vietnam and he had, had some negative experiences while he was there. And we always just let them off whenever it was dusk. So it wasn't dark. And then whenever I got older and I was like, oh, this is cool. This is what this shit actually supposed to look like. I was like, oh, okay. Um, but it was a different kind of experience. And so us knowing that then kind of put it into a different context.
Mhm.
But for families who have been with someone who has experienced some level of trauma, I think being going to some type of family counseling, or if again you're working with a trauma expert and they're, I don't see couples and I don't see families, but if I'm working with someone with trauma and it's a part of it's appropriate for that person to be brought in and to discuss what this is looking like so that way it conveys some level of greater understanding, then I'll do it in a heartbeat. But that is also addressed as part of some level of treatment and care. Again, from military professionals, I can't tell you how many that I would see that, were really excited to come back and be a part of like their son's baseball game, but then the crack from an aluminum bat sounded just like a gunshot.
Yeah.
Or, again, the guy driving down the street and it's trash day. He's got his kids in the back of the car, but in his mind, it's not trash. It's an IED and they almost wrecked the car.
Yeah.
And so it's those types of things. Or it's even whenever, um, I had a patient, a female patient, and she smelled something that was, again, serving as the real word for trigger, um, coming into her life and just started crying and just having this real intense emotional reaction around her kids. And all of a sudden, she was just back in the situation and didn't understand because she was in like an elevator at a store, but because the elevator smelled like oil, which her perpetrator smelled like that because of what his profession was,
Mm.
at that moment and at that point of time, it served as a trigger. And so for her then to understand how our senses then develop um, responses and how that can affect us from an emotional standpoint. That was what she needed to understand about her trauma in order for her to work with it. And so, again, those things like touch is
Yeah.
another sense that's important.
It's like it just keeps showing up, you think you get it resolved and you might for like a few months, a year, many years, but just knowing or acknowledging when something shows up that, oh, yes, I could be responding to trauma in a new way. There's something
Mm-hmm.
that has now triggered this. And I think, again, if I had things to do all over again and I could go back to when I started experiencing panic attacks, like I probably should have gone to therapy at that point. In addition to medication, I probably should have explored more of these things to really get to the root cause of why I was experiencing these emotional issues at the time, and still do. I mean, I still feel like I'm exploring it. That's why we have a podcast, and I'm constantly working on myself. But
Mm-hmm.
just the awareness, I think, not thinking like you've I fixed that part of my life. I'm guilty of that myself. I fixed that. That doesn't affect me anymore, and I'm going to put that box back on the shelf. um, it's still going to affect you. And you just don't know when it's going to come out or what's going to make it come out. But
Mm-hmm.
recognizing that um, that's likely the root of a lot of our emotional issues or emotional disorders like anxiety, depression, ADHD, whatever. It certainly could be a root cause. Not that you were like born defective.
No.
you know,
Right, right.
which I think a
Like,
lot of people still think like, oh, I was born this way. I was destined to be, crazy
right.
or whatever. Um, but no, I mean, you're just responding. Your body is responding to something it experienced.
Mhm.
The
In the
end.
case of trauma, yes. In the
Right.
case of trauma, that is exactly what happens, and it does change your physiology. And
Yeah.
that's, again, not even, I mean, we've talked about sleep, we've talked about GI, it changes your brains, it changes your neural pathways. I mean, it changes everything.
Yeah.
And for that to be the case, I think it does render a certain amount of respect for how intrusive, not just in terms of intrusive thoughts, but how intrusive trauma can get rooted within our system as a whole. And that's where I get very protective over the word trauma and
Mm-hmm.
trigger,
Mm-hmm. Yeah.
is
It's
because,
very widely used these days. I think you would agree. We're by no means trying to um, discredit anybody's feelings or their experiences, but that it is sort of overly used on TikTok or, just some of the social media platforms. You just hear that word a lot. Like I got triggered, and okay, and that in some ways that's right, but are we using these terms correctly? Are we just throwing things out because it's the buzzword of the decade?
yeah.
Um, so hopefully we've given some insight. We're not here to treat anybody. Sarah is a medical professional. I am not, never have been. Uh, but that's not the goal of this podcast. We just want to bring awareness to the topics each week, and we want to destigmatize saying out loud, if you suffer from a disorder of any type, that's okay, that
Hmm.
there's nothing wrong with you, and that you're like most of us at this point. I think,
Yeah.
not most of us, but there are so many, you're not alone. There's so many people walking around, successful adults, or at least what we put on social media, we look incredibly successful. That doesn't
Hmm.
mean that I don't have crazy anxious thoughts all the time. I told my husband the other day, I was like, do you think I want to think these thoughts? Do you think I want to have this response? My brother, every time he calls me, God bless him, my heart starts just beating out of my chest because I think he's going to tell me something terrible about something happened to
Yeah.
my. I don't know why. I don't know why these thoughts come. I don't know why I can't just go, oh, my brother's calling me. But it is.
It's
Yeah,
because what happened? My number one word people are not allowed to say in my office is why.
right.
You are
It's because
absolutely not allowed to say that word ever in my. I will literally. We will have a talk at
Yeah.
that point in time about using that bad word because it makes sense. Why? What
Because
ha-
something happened.
what
Yeah.
happened?
What
Yeah,
happened? My brother called me and told me my dad had died.
right.
you know, like it
Yes.
again, it's just it's okay. It is what it is. I'm learning to work through these things, but just acknowledging like
It's
it,
fine.
it yeah, it's fine. And that I know I'm not the only person because I say it out loud to my friends and they're like, me too. Or, everybody's got a story and just normalizing that and that
Mm-hmm.
there's nothing wrong with you. You're not crazy. And that
Mm-hmm.
at some point in our life, we're all going to experience some sort of negative emotions.
Absolutely.
Mm.
And why is probably the most self-damning question we ask of ourselves, and that just again throws everything down a huge rabbit hole.
Mm-hmm.
Whenever we have those triggers, it's about what happened. That's an appropriate thing to have happened. What happened?
Sure.
This is how my body responds when this occurs due to an event that happened, which
Mm-hmm.
makes it a normative response considering those things. And the more that I don't even know that I'm okay, but the more that I acknowledge this as being a fact of the situation, the less effect it will have on me overall. That's it.
Yeah,
That's all.
that's it.
That's all.
Well, hopefully our listeners gained something from this topic. We could probably go on for days because there is
Mhm.
so much literature out there on trauma and trauma response and um, warning signs. I mean, you can Google it, you can look all these things up, but
Yeah.
hopefully we've given you some validating messages here today, and that by and large, if your life is being disrupted by the thoughts, feelings, physical symptoms, reach out to somebody, get some
Yeah.
help.
It is there is so much hope, and Craig's message in this as well. There is no reason to continue to suffer or feel silence because, again, in most of my patients that I've seen with PTSD, it's not even like long term. You know what I mean? Like I'm seeing
Right,
you just for a real short period of time. You understand what's going on with you, and then you've got this.
right.
That's all it takes. And then sometimes every now and then we come in for checkups or whatever else, and that's okay too. A cancer patient, I'm going to see them every time they have a scan. Why? Because their life was threatened by cancer, and now they're having to reapproach it.
Yeah,
It's this is what we're breaking down as the normative response to things that happen within our life. So we'll have resources for you on our webpage.
that's right. Check out our webpage, the LYLAS podcast, or just lilaspodcast.com. Check us out on Instagram at the LYLAS podcast and on Facebook at the LYLAS podcast. So yeah, come talk to us. Come tell us what you think of this episode. If you want to hear more on this topic or any other topic, we're always open. We have some amazing topics coming up this season. We are so excited. They're not all going to be heavy. Some of them are fun. We're really excited. So stick around for the rest of the episodes this season. But um, for today, we're signing off from
That's
the
it.
last podcast. Till next week, guys. Thanks for joining us.
Thank you. We're out.